Welcome to this presentation about nose surgery and the damage you can receive from that. I'm going to talk quite a lot about empty nose syndrome, and here's an index. You can pause the video and find the most interesting parts you want to learn more about. In this video I'm going to talk about nose surgery, and specifically nose surgery that's supposed to help you with nasal congestion. I'm going to reveal the truth that's hidden from you, from doctors, from hospitals, from surgeons. And I'm going to start to talk about my specific situation and what happened to me, what kind of damage I got, what kind of symptoms I have. And after that, I'm going to go into the scientific explanation a little bit more about this condition. So a few years back I had some minor problems with congestion in my right nostril. Wasn't really a big problem, but I had this for a while. I wasn't congested all the time. I was congested sometimes, but I went to see a doctor to see if I could do something about it, and that was my biggest mistake ever in my whole life. After that, I went to X-ray. I was told I had deviated septum. I was told I needed to operate on that, and I got quite a lot of problems straight away after. Tremendous problems with my sleep and dryness. Dryness wasn't too bad in the beginning, but it started to becoming slowly worse, like every year. So after that, I went to have a private X-ray done because the hospital didn't want to pay for one, and then I realized that the surgeon he didn't only remove the septal spur I had. I had a septal spur in my septum. That was the reason for my deviated septum. But he also removed my turbinates. So after that, my life is destroyed. My life is more or less over. I suffered tremendously, and after that I have spent a few thousand hours of research into this condition. So that's why I think it's a good thing to listen on me and to hear my story. And the reason why I'm doing this video, it won't change my situation, but my life is destroyed, and if that's not going to be in vain, maybe I can help someone out there to rethink if they really need to have this kind of surgery performed, or if they can fix their congestion by a diet change or something. So it's mainly a video for you who are thinking about having a surgery for nasal congestion. It's also a video for people within the healthcare industry, within the healthcare system. I hope some of you can be open-minded to listen on the patient stories. I don't think the situation will change really, because it's a big corporation or big machine behind all of this. It's companies that produce these medical instruments for surgery. There are big education that's performed. A lot of people open their private businesses at least here in Sweden. to start to earn extra money on this kind of surgeries. So of course, this is going to continue, and it's not so much we patients can do about it, more than just educate ourselves. And this is what I'm going to try to do here, to educate you, to learn you what will happen during these kind of surgeries, and so on. This is going to be quite a long YouTube video, so for you who don't want to listen to it and want to leave right now, I just want to say one thing for you that's extremely important. You have to understand this. So a surgery to your nose, specifically when it's about turbinates and septum, it's not only a surgery locally in your nose, it's a surgery to your nervous system and to your brain. So a surgery to your nose is not a local surgery only in the nose, it's also a surgery to your nervous system and to your brain. And that can cause tremendous problems. So stay a few minutes more and I will explain all of this. But first I'm going to tell you about my situation. I'm going to show you a slideshow here and explain everything in detail. Unfortunately, some of this slideshow, or most of it, is written in Swedish. And so for you English-speaking listeners, we're not going to be able to understand everything, but I'm going to try to explain most of it in words. So before I start, I just want to say that, like I told you, this slideshow is in Swedish. So for you who understand Swedish, you can just pause the YouTube video and you can read everything for yourself, because I'm not going to read up all the pages, all the text every time. So just pause the YouTube video and read it through. Yeah. So like I told you, I went in to have a septoplasty surgery to my septum to correct the septal spur. But the surgeon also removed my turbinates. And here on the left side you can see that's how my nose was before the surgery. So here you can see the inferior turbinate and the inferior turbinate on the other side. This is how it looks after. This is not all the sequence of course of my nose, so it's totally empty in the first part here. You might see that on the other images. But like you see, here is my right nostril. Now after surgery, you can see the black area here is now completely open because of the septoplasty, and also because of the reduction of the turbinates. This is X-ray from below, so you can see my turbinates here before the surgery were all the way up to the front. So these are about 5 to 6 centimeters long in a healthy adult man. So after the surgery, it's just this part that remains. And here you can see from the side, this is how it was before surgery. This is the inferior turbinate, and this is after the surgery. I have got something that's called empty nose syndrome, or actually I don't like that name, and I'm going to explain why, and I'm going to come up with another name later. But to start with my problems, first after the surgery, dryness started to got worse like every year, and sleep got really bad straight away after surgery. So nowadays I wake up, I need to use sleeping pills. Like I've been doing that for years now, and even if I use sleeping pills, I wake up like every 2 hours. So I wake up and I gasp for air. I have a sensation of air hunger. I'm not relaxed with my breathing at all. If I look at my watch, I can see that my pulse is too high. I can also see that I can also feel that my breathing is too shallow and a little bit too fast. It's not like hyperventilation, but it's too fast to have a relaxed breathing. Also, I have no natural air resistance in my nose, so the breathing feels stressful, not relaxed at all. Sometimes I need to put cotton inside the nose to make some more air resistance. And for you Swedish listeners, you can just read through this page, and I'm going to skip for the next one now. Yes, I told you about the dryness, and it's not like dryness on the skin. When you have a little bit dryness on the skin, it's not like that at all. It's the whole mucosa inside the nose. It's extremely painful. You get sensitive to all kind of particles, to smoke, to dust, to anything that's if I just walk inside a store where they have some products in plastic or rubber or other products, they give away some small tiny particles into the air, and those small particles, it's tremendously painful. It's not like before I could say this smell bad or this smell good. It's not really connected to how I sense the smell. It's connected to pain. So for example, when I cook food inside the oven, there will be some small burned particles in the air, and those are extremely painful in my nose. I also have nerve pain from this right nostril where I had the septoplasty performed, and it shoot out in my right eye, and it gets a lot worse when it's cold. And the next thing I have is when I'm outside, when it's below like around 12 degrees, I get my nose like runs a lot. It's extremely annoying, and I have discovered now it's because when you're outside when it's cold, your eyes produce more tears, and those tears, there are some small holes here, and those tears, they drain inside your nose behind the front of your inferior turbinates. And on my left side, that hole, that orifice of the tear drainage, there is no turbinate there anymore. So it just flows straight out the nose. Normally when you have the turbinate, it's like, more or less like you throw a bucket of water onto a wall. It spreads like that. Now it just comes straight out, and it's nothing inside the nose that can like keep it there. And also I lost how to say in English, I think is it cilia? It's small hairs on the turbinates that they do some rhythmic movement to make the mucus and everything and tears and everything to go backwards into the nose. So that function is destroyed on me, and it's very annoying. And the next thing I have is when I'm outside, when it's below like around 12 degrees, I get my nose like runs a lot. It's extremely annoying, and I have discovered now it's because when you're outside when it's cold, your eyes produce more tears, And those tears, there are some small holes here, and those tears, they drain inside your nose, behind the front of your inferior turbinates. And on my left side, that hole, that orifice of the tear drainage, there is no turbinate there anymore. So it just flows straight out the nose. Normally when you have the turbinate, it's like, you know, more or less like you throw a bucket of water onto a wall. It spreads like that. Now it just comes straight out, and it's nothing inside the nose that can like keep it there. And also I lost, how to say in English, I think is it cilia? It's small hairs on the turbinates that they do some rhythmic movement to make the mucus and everything and tears and everything to go backwards into the nose. So that function is destroyed on me, and it's very annoying. Yeah, my sense of smell is also heavily reduced in my right nostril where I had the septoplasty performed. The other nostril is more or less the same. Also, I've got a lot of problems with my eyes, and I discovered now it's because I've been using these sleeping pills for years now, and those dry out the eyes. So I have some glands coming down in my eyelids. They call them meibomian glands. When you use this kind of sleeping pills, they affect a substance, neurotransmitter that's called acetylcholine, I think in English. It blocks that signal, so there are small muscles around the orifices. Those muscles won't get the signal to open. So those glands become blocked, and also the gland itself stops to produce good quality of oil. So after a while that builds up a pressure because the oil and the grease and everything doesn't come out. So after that, those meibomian glands, they die. So that's not directly from the nose surgery, but it's a secondary damage because I've been on these sleeping pills for years now. And I'm also extremely sensitive to particles in the air, like I told you, and the humidity. Before, I could be in any kind of environment without any problems. I could be in dusty environments, in dry, in humid conditions. I wasn't affected at all. So now I need at least above 35-40% of relative humidity. If it's below that, it's so painful in my mucous membrane inside the nose. And yeah, like I said, all smell, everything, and it's a big problem with the dryness sensitivity, because you know, when the sun shines in through windows, for example, it gets really warm quick, and it dries out as well. So now I had to put like some protection on the windows, some sun protection film on the windows. Also when I'm in car, especially on the summer, or when I'm in my camper, it's so extremely painful because it gets so dry and warm. So yeah, it's so annoying, and people who don't have this condition can't really understand how really how annoying and painful this is. And also I told you about the sleep. I have really big problems with sleep, and that's because I have this air hunger sensation. That's connected to the empty nose syndrome. I'm going to explain more about this condition later. But I have this during the night, I have this during the day, and in my case I have some air sensation, some nerves in my left nostril that still work, so I can feel the breath inside my left nostril, but I can't feel it in my right nostril. When this nostril, the good nostril, blocks, I get this air hunger sensation. Some say suffocation. I think it's not the correct word for me, really. It's more like air hunger. You feel stressed with your breathing, not relaxed. You breathe and you breathe and you breathe, but you don't get the relaxing breathing. And as soon as my left nostril opens up, the good one because it's also damaged, but as soon as that one opens up, my breathing comes down, I feel relaxed again, and yeah. So this is how I need to live my life now. I need to have the humidifier next to my bed. I put a hose here, and so I can get the steam just on my face. And when I'm on the computer here now, I need to have a humidifier here as well. If I'm out, for example, on a bus or something, and it's summer, it's dry, it's warm, I need to use this kind of, it's also a humidifier, gives you some moisture, or I use this mask. It like catches some of the moisture when you exhale, so it keeps that inside the mask, and when you inhale again, you get that into your nose. So now you know about my condition, what happened to me. So let's try explain a little bit for you who are going to do nose surgery, what this is about. So let's see here. These are the turbinates. You have one here, that's the inferior turbinate, and you have a middle turbinate here, and you have the superior turbinate up here. It's a really small one, and that's how they look from the side. This is another image. You can see them here. That's the lower one, inferior one, the middle one, and I think the superior one is up here. This is how it looks from the front, like that. So there are some bones, some bone structure growing down from the skull like this, and that's surrounded by mucous membrane with a lot of blood vessels inside, and it looks more or less like this. And this is an X-ray, you can see them. This is the inferior turbinate, and this is also how it looks like inside the nose. And these are about, the inferior turbinates are about 5 to 6 centimeters long. Here we have another image. You can see them. They grow out on bone from the maxillary sinus wall here, and then they are surrounded by mucous membrane and blood vessels. So in my case, the surgeon have removed just all of this in the first, like, I'll say 4 centimeters of the nose, 4.5 centimeters of the nose. So it's just a black hole here in my case. So I'm now going to explain a little bit the functions of the turbinates. It's not all of the functions the turbinates have, because it's a lot of functions, but it's a few of them. So first of all, there are some goblet cells on the surface of the turbinates, and also on the septum, and yeah, all over the mucosa in the nose. And those goblet cells, they produce secrete that have some active compounds. I'm not sure about the words in English. I think it's lactoferrin or something, and lysozyme, and also IgG antibodies. And those substances, they are antibacterial. So they kill viruses and bacteria. And that's a really important part. Also on the surface of the turbinates you have these cilia, or small tiny hairs I explained before, and they do some movements to make the secrete in the nose to go backwards so you can swallow it. So you know the bacteria and everything, or dust or pollution, gets trapped in the mucus in the nose, and those tiny hairs, they produce these rhythmic movements to make it go down, so it clears and cleans the nose. And also on the surface of the turbinates you have these TRPMH. It's written wrong here. It's TRPMH. And those are called thermoreceptors. Those are the same kind of receptors that you can sense yourself when you blow at your hand like that. It gets cold. And when you have a functional nose, you can also sense it's a cool sensation when you inhale, and especially if you go outside you can feel it. When you go outside on the autumn when it's cold and you think like, oh, what a fresh day, the air feels so fresh and so clean and everything. You can't feel that. The only thing you feel is the temperature, and it's those thermoreceptors, and it's those thermoreceptors that are involved in empty nose syndrome, and I'm going to explain way more about this later. Also, the turbinates are there to filter the nose from pollution, like I told before. They are also there to heat up the air. I have another image I can show you. And when you exhale, there are some air, some water, some humidity in the air that evaporates on the surface of the turbinates, and that air, that water is like taken up again into the body, so it saves the body of water. The turbinates are also there to regulate how much air the lungs will receive and the body will receive. So when you're outside doing exercise, walking, being active, the turbinates are supposed to shrink down to allow more air to reach your lungs. And when you relax, sit down, when you are sleeping, those turbinates are supposed to swell up a little bit, not too much to block the nostril, but a little bit to reduce the airflow, to cause more air resistance. And that's one important function, because when you relax, when you sit down, you should have more air resistance to get a calmer and more relaxed breathing. And when you remove the turbinates, that function doesn't work anymore. So you have a maximum flow all the time. Also, the turbinates are there to for you to have something that's called the nasal cycle. So it's basically a system where one turbinate swells up or the turbinates in one nostril swells up, while the turbinates in the other nostril shrink down. So this allow like the airstream to go from one side to another side and back to the other side. And this allow one side to rest, to produce more mucus, to heal itself from, it gets some wear and tear from like constant breathing, you inhale dry air. So it allows one side to rest, and it allows the other side to take over the process. And you also allow some healing between. And when the turbinates swell up, it also produces way more secrete of those lactoferrin and lysozyme that I described before. So if you don't have the turbinates, both nostrils are always open at the same time, and you can imagine yourself like you get a lot of more wear and tear on your mucous membrane. And also another function of the nasal cycle is it allow for a constant air resistance, because one side swells up and more or less blocks the airflow totally, and the other side opens up, so you have the same air resistance. It doesn't matter if this side is blocked and that side is open, or the other way around. So it allows one to have a normal air resistance all the time. So this is another function that is destroyed when you remove the turbinates. So next image, this is the one I was talking about before, how the turbinates work to increase the air temperature. If the air is, for example here, minus 12 degrees outside and have a humidity of 30%, it passes the mucous membrane and it passes all the turbinates tissue here, and when it reaches the back of the nose, the throat, it's 25 degrees instead and have relative humidity of 90%. So of course when the turbinates are removed, this function is destroyed. So you inhale cold air and it's not good for the lungs. So let's talk about natural reasons for nasal congestion. This is something that the healthcare system, the doctors, they don't tell about this, because they want to continue to do their kind of surgeries. So they won't mention this for you. So it's most of the time, if not all of the time, is related to either allergy or food intolerances. So it could be IgE or IgA mediated allergy. And then it's a fast reaction. If it's IgE or IgA, it's like if you eat something you are allergic to, for example a peanut, you get a reaction in like 5 minutes, like that. So that's pretty easy to know. Most people know if they have some kind of allergy. The kind of allergy the healthcare system here in Sweden don't test and don't tell you about is IgG mediated food intolerance allergy, or food intolerances. So it's a slow reaction in this case. This could be from 12 to 36 hours, or 12 to 72 hours actually, if I remember correctly. So it's really hard to know if you have this kind of allergy or intolerance. So if you eat something today, you have antibodies against. You could have a reaction like tomorrow or the day after tomorrow. So this is a big reason for nasal congestion. So if you live in Sweden or in Scandinavia, I recommend you to go out on this site here, amudomedical.se, and here you can do IgG food intolerance test. I have no cooperation with this company, so I don't earn any money or anything to say this. I've done a test myself because I had ulcerative colitis, and that was the reason for my nasal congestion. I didn't know at the time, so I did a test, and I got the list of I don't remember exactly now what was, like 12, 13, 14, 15 foods that I had antibodies to, and I removed those foods, and I healed myself from ulcerative colitis, and I had ulcerative colitis for 10 years. 10 years. and I tried everything, all the medicines and everything, and it didn't help. But I removed those foods and it helped me. And that was 99% probably the reason to my nasal congestion. It could also be histamine. Histamine is a natural substance that we have in many foods, and it's high concentration in like some canned foods, some where the food is a little bit, how you say, old. So then there is a process of where histamine is created. So cheese, for example, canned tuna is another example, and you can Google this yourself, foods with histamine. Histamine is a thing that, especially if you are in lack of one enzyme that breaks down histamine, especially in that case, it will swell up your turbinates and cause one inflammation inflammation in your body, really. So you can do one test for DAO enzyme. That's one enzyme one should have to break down this histamine. So it's pretty common reason for nasal congestion. Also, if you have some kind of inflammation in your body, it could be from autoimmune diseases like I had, from ulcerative colitis. It could be from Crohn's disease. If you have some kind of arthritis, or there are many kind of autoimmune diseases. Most of the modern not acute diseases have some kind of autoimmune component. Also, nasal congestions could be related to the air quality. So if you live in a house where you have mold, where it's dusty, the air quality is bad, you have some substances that could be irritating the nose, and that could also be a reason for nasal congestion. And food with inflammable substances. You could read up this yourself because it's too complicated and too much to explain in this video. But I cured myself from ulcerative colitis with diet change. So it's extremely important to remove those kind of foods if you want to remove inflammation in your body. And just to say some foods with that triggers inflammation in your body, it could be milk products, even if it is free of lactose. It could be wheat, barley, rye, for example. For some people it's eggs, nuts and seeds could be irritating for some people. It's a lot to read through, so I'm not going to explain everything about that. There is one article, and you can go out here and you can just follow this link. So there will be more explanation about what kind of foods that affect and contribute to nasal congestion. So now I want to talk a little bit about the information you get before the surgery. So in my case, I saw the doctor and they sent me to one X-ray. And on the X-ray, they told me I had a deviated septum, and I asked them, okay, do I need to have surgery, and what kind of complications can I get from that surgery, and what risks are there? And they told me, well, there is only risk for bleeding during the surgery and for infection just after the surgery. And on this document here, I've been making a screenshot on that one before the doctors had time to remove it. But on this side, on this document, you can see that there is absolutely no communication about the risks. And for you who are English speakers, you won't understand this, but for the Swedish ones, you can read this through for yourself, and you will see that there is no explanation about the risks. And this was the doctor who made me to have the surgery. And I asked him. His name is Bengt Nilsson Helger, and he works at Kalanderska Hospital in Gothenburg, and also at Öron Näsa Hals in Södra Älvsborgs sjukhus in Borås. And I asked him several times about the risks, and he just told me, oh yeah, there is only bleeding and risk for infection. And if we skip to the next slide, we can see here are the complications. So it's just bleeding, swelling around the eye. It could be pain or fever. If more than 38 degrees fever, you should contact the hospital. Phone number is here. So and here is another one. They tell about the bleeding. They tell about what kind of food you should have after the surgery, and about what kind of activity you should have. This is just the follow-up information in 7 to 10 days. So there's absolutely no information about what kind of damage you will get from this surgery, that there is a risk of empty nose syndrome, a risk of your nose becoming extremely open, extremely dry, that you will get infection, that you can get holes into your septum, septal perforation, or holes into your sinus. Yeah, and this is the surgeon who did my surgery. So for you Swedish viewers, yeah, this is the Dr. Anders Arnbrandt. He works at Sahlgrenska universitetssjukhus and also at Kalanderska universitetssjukhus, Kalanderska University, Kalanderska Hospital. So yeah, all surgeons are the same, so it won't matter if you have another one, but yeah, I wouldn't choose this surgeon for sure. So let's go to the next subject. The deviated septum myth. So when you go to see a doctor, at least here in Sweden, the first thing they will do is to send you on an X-ray to see how the nose looks like. And on that X-ray, in most cases, they will see and tell you that you have a deviated septum, and they will use that as an argument for you to have septal surgery. But it's not true. More or less everyone have a deviated septum. At least 80% of people have a more or less deviated septum. So it's normal. And let's look on these pictures. Here we have 3 patients. On the left side we have one patient here with absolutely straight septum. And you can see the turbinates here, and the lower ones, the inferior ones, and the middle ones here. And the black area here is where it's open, where air can pass. So you can see that it's black here, air can pass all the way around here. And if you go to the other side, you have a patient here. His septum is bent like this to the right. So there is a smaller opening on the left side and a bigger opening on the right side. And what the surgeons never tell you about is that if you are born with a deviated septum, with most people are. Then the turbinates, they adopt the size and the shape after the how the nose is designed, how the space, how much space there is, and everything. So it becomes totally adopt. So you can still see here, even if the septum is bent to the right, there are a gap here on the right side where air can pass, and even on the left side there is gap here. So it doesn't matter if the septum is deviated. It's not the reason for nasal congestion. And we can also look at these patients. We have one turbinate a little bit bigger on this side and a little bit smaller turbinate on this side. And the septum is bent on the other side. So yeah, the body adopts the turbinates and the size and how they grow. So it's not the reason. The reason is allergy and food intolerances, like I told before. But it's a very good thing to make people to go for this surgery, because they can point out, okay, you have a deviated septum here, you need to do this surgery. And like a patient, if you don't know, it's obvious, I have a deviated septum, of course, it's the reason for my nasal congestion, so yeah, I go for this surgery. But it's just a way to trick the patients, so don't believe in that. So I'm going to let you listen to one doctor and what he say about the deviated septum. It's going to be a few seconds video.
This is Dr. Stephen Park from drstephenpark.com. Today we're going to talk about the deviated septum myth. A deviated septum is blamed for everything from a chronic stuffy nose and headaches to sinusitis and smell or taste problems. One of the most common statements that I hear from patients is that they were told that they had a deviated septum and that was a cause for their breathing problems. I have to admit, every time I hear this, I roll my eyes internally, since by definition, everyone has a deviated nasal septum. No one has a perfectly straight septum.
So like you see here in this video, it's not only me who claims that a deviated septum is normal. Also this doctor, he say that most people have a deviated septum, at least more or less. So this is just a reason doctors use to convince you to have a totally unnecessary surgery to your nose. To boost the revenue of their companies or to keep their business up and running. It's allergy and food intolerances or general inflammation in your body that is the reason for this. The only time where it's logical to have a surgery to your septum is if you had a damage to your nose in adult age. You fell on your nose and you damaged the septum. Yeah, then it could be a reason to have the surgery, because the turbinates will not be able to adopt their size and their shape in that case. But in all other cases, most cases, that's not the reason. The reason is, like I say, allergy and inflammation, mold, etc. So yeah, don't trust doctors in this case when they say that. So there is also another thing doctors use to convince you to have nose surgery. If they can't find a deviated septum, they can convince you in another way. And from the x-ray, they can tell you that you have I think in English it's called hypotrophic turbinate. It's an enlarged turbinate. So they do one x-ray, and like you see here, they get one image in like a half a second or even less than that. and they say, okay, look here, Mr. Patient, you have a extremely large inferior turbinate here, and you have a large middle turbinate here. This is the reason for your congestion. But the thing is that it's just one moment in time. And I told you a little bit before about the nasal cycle. You have a nasal cycle that goes from one side to the other side. This side swells up and the blood vessels in the other nostril shrinks down. So if you take this image like 1 hour later, it could be the opposite side. So this side is big and this side is small. But they won't tell you this, of course. They would use this as another reason for you to have surgery to your nose. So here we can see one example of this. We have a patient A on these two images and patient B on these two images. So X-ray was taken, and you could see in this moment of time the right side of the turbinates here in the right nostril was swollen and big, and on the other side they were small. And then they waited 1 hour or something, I don't know the time, but then they could see, okay, now this side is small and this side is big. So yeah, another example of patient B. This side is big, this side is small, and an hour later, yeah, it's opposite. This is small and this is big. So you see the doctors, they use this and they say your turbinates are hypertrophic, they are too big, you need to reduce them in size. And it's just a lie, because you have a lot of blood vessels in them, and those blood vessels, they dilate or shrink down the diameter of the blood vessel, and it shrinks or it contracts or grows the turbinates. So you can see how the septum is, if the septum is deviated or not, but you can't really look at the turbinates because they differ in size from one moment to another. So let's talk about the condition that I've gotten from my surgery, and many other people also have gotten from the surgery. And it's called empty nose syndrome. It's a fucking stupid name. I hate it. It doesn't say anything at all what the condition is about. I think there was an American doctor and a Swedish doctor, and they were the first two who started to talk about this condition. And the Swedish doctor mentioned something like, oh, look like this nose, and this person have a lot of symptoms. This nose looks like an empty nose. And they made the name from that, empty nose syndrome. And the problem with the name empty nose syndrome is that it has nothing to do at all with if you have the condition or not, because the nose doesn't need to be empty for you to have this condition. You can have damage to the mucosal lining, to the thermoreceptors, and have this condition. You can have your turbinates remaining, you can have an intact septum, but you can still have this condition. So a better name would be iatrogenic nasal dysfunction. And iatrogenic means a damage caused by healthcare providers, by doctors. And yeah, nasal dysfunction, you understand. So yeah, nasal dysfunction secondary to damage from doctors. So that's a good definition. And if we're talking about specifically the air hunger, the suffocation sensation, and the stress on your breathing, and the lack of air perception, air feel in your nose, when we're talking about that, we could name the condition TRPM8, mediated iatrogenic nasal dysfunction. And that's because those TRPM8 receptors are mainly what's involved in this condition. There are also other receptors involved, like pressure receptors and things like that. But the main reason is those receptors. So these receptors are located pretty much all over the mucosa inside the nose, but they are more concentrated in your inferior turbinates, in your middle turbinates, and at your septal swell body. That's an area, it's also called the fourth turbinate, and that's an area on septum a little bit above the inferior turbinate and in front of the middle turbinate. So these receptors are located on the surface of the mucosa, and those are the exact same receptors that you can sense them when you blow on your hand like that. You get a cool sensation, and you also get that cool sensation inside your nose. And when those receptors become damaged, destroyed by radio frequency, or destroyed, actually removed, if the turbinate removed the turbinates, these receptors, you lose them forever. It could also be secondary damage to these receptors, because if you remove your turbinates, destroy your turbinates, your nose is going to be open, it's going to dry out. Over time, that dryness can cause destruction of the mucosa membrane. You can get infections, and that infection can also destroy those remaining receptors. And when that happens, the brain won't receive this signal. This signal should be sent via the fifth cranial nerve. And when that signal is not sent to the brain, there is a distress. And that's when you get suffocation sensation, air hunger, breathing problems. It feels more or less like the nose is congested, but it's open. So I'm going to talk a little bit more about empty nose syndrome, different complications and symptoms of the condition. But right now I'm thinking we are going to talk about how people experience the condition. So you who want to do this kind of surgery can get a view of how much suffer you can possibly get. So I'm not going to read up all of these comments. You can pause the video and read up them yourself. But I'm just going to read a few of them. Start with this one. Does anyone else symptoms get so much worse at night when trying to sleep? Dry nose, throat despite humidification, nasal mist, nasogel, suffocation feeling, I can't sleep, I can't get comfortable, feel like airway closes off. When I do fall asleep, I wake up in panic after 30 minutes. Any recommendations appreciated. This one, sleep disturbance has got to be the worst symptom of ENS. Everybody who has horrible sleep, please like or comment. For me, I had 4 hours sleep in 3 days. I usually wake right back up once I doze off, but if I manage to actually fall asleep, I usually only sleep 30 to 45 minutes and jolt up gasping for air. Let's go to the other side. I think you can read all this yourself here, pause and read it. I can just read the last one here. Not coping, don't want to go on. I don't know how to bear this and to get on with life. The lack of nasal resistance and the impossibility of sleep breathing is unbearable. 3 weeks ago I had a happy life and now it's just gone. I cannot see a solution for me and I'm not coping. Switch side again. Let's see. Yeah, you can read this yourself. I'm going to skip for another side. Another member of this group from France is dead. Suicide. From what I know, he had a few surgeries, one by a young doctor who messed him up. Almost all his inferior turbinates were missing. He was struggling since 2019. Father of 2 children. I can't really answer questions because I don't know all the details, and I knew him just a bit. It's been discussed in a French group. Rest in peace. So yeah, it's totally sick. Another one. I have just received some tragic news that I thought should be shared with the group. We lost a member of our forum named, I removed the name here, to suicide a few days ago. He has been struggling greatly with empty nose syndrome and all of the symptoms that come with it. He was a German sufferer who had a very severe case of ENS. Rest in peace, my friend. So yeah, during the 3.5 years I was in different forums on Facebook and internet. There were like 7 people or something like that who committed suicide from this condition, and that tells quite a bit how terrible this condition is. So yeah, I'm going to show you 2 short videos about 2 people who have this condition, so you can see for yourself and listen what they have to say about their problems.
When I had sinus surgery 2 years ago, I never would have guessed that it would cause this degree of suffering. To make it worse, I probably didn't need the surgery. The procedure that I had is called a turbinate reduction. Most people have no idea what the turbinates are, but they are extremely important to your breathing. Now, because of the surgery, mine don't work anymore, which means the air that I breathe into my lungs is very often cold and painful. And since you breathe 24 hours a day, it's pretty bad. It has destroyed my sleep. The nerves in my nose and in my sinuses don't pick up air as well as they used to. I barely feel air in my nose and my sinuses, and this pretty much gives your brain the signal that you're suffocating. And very often that's what it feels like, is suffocating. So I dread going to bed for the first time in my life. I hate nighttime. Sleeping is a nightmare. I very often have woken up gasping for air. When I do sleep, it's usually from just total exhaustion. In the daytime, I'm physically and mentally exhausted from the poor sleep that I get every night. One of the main problems with turbinate reduction surgery is that most people have no idea what the turbinates are. If your tongue became swollen and the doctor wanted to cut part of it out, you'd have a serious problem with that, because we all know that the tongue is important. But because we don't know that the turbinates are important, we don't really hesitate when the doctor talks about doing surgery on them. When you think that the turbinates are just useless pieces of flesh that are blocking your airway, it kind of makes sense to surgically remove some of them. Another serious problem with turbinate reduction surgery is that your turbinates are not big in the same way that, say, your ears are big. If you have big ears, you just have big ears. Your turbinates are big because they're swollen, and they're swollen because they're irritated by something. It could be your diet, it could be allergies, it could be something you're reacting to at your home or where you work. So those things can be eliminated, and it just makes more sense to attack the problem that way than to risk ending up with a condition as horrible as mine through surgery.
Hello, Dr. Song. Hello, Jay. Hello, G&G. Here I'm in Germany in a hospital. They will try to make me better, but it's still maybe not possible. I don't know. It's flip a coin. And yeah, I suffered day by day because your surgery, Dr. Song. You make 2 holes in my nose, and now you can put a train inside or a truck, and I cannot sleep. I feel energyless and hopeless, and I ask myself all the time why I come to Korea to G&G. Have a nice day.
So like you see, it's a lot of suffering in this condition. So if you want to read more, this is a good article, Empty Nose Syndrome, a guide to diagnosis and management for medical professionals. In this one you can read more about empty nose syndrome. There's a link up here, but of course you can't click on the link in the YouTube video. But I'm going to add this link on my OneDrive account, and I'm going to share that. I'm going to share the whole PowerPoint presentation on OneDrive. So under this video here in YouTube, I'm going to put the link, so you can find this PowerPoint presentation and you can read everything here, and you can also click on the links in that PowerPoint presentation. So now I'm going to talk a little bit further about ENS, why it happens, how it works, what complications there is, and yeah. So on this page I'm not going to read up everything here because I've been talking about that pretty much before. So you can just pause and read that yourself. So there's a few reasons for empty nose syndrome. And the main reason from my view is the lack of the thermoreceptors, the damage of those receptors. It could be straight away from the surgery, or it could be secondary from dryness and infections. But there is also another reason, not as big, I think, but when you remove the turbinates, the volume inside the nose increases a lot. And the thing is that these receptors, the thermoreceptors, okay, you lose them in the turbinates, but in one way you still have some receptors remaining in the septal mucosa, in the nasal floor, in the middle turbinates, and so on. But those receptors will be less activated when the nose becomes open. One reason for that is the, I think it's called Venturi effect in English as well. And it works like this. When you inhale through your nose, there is first openness in the first part of the nose, and when the air reaches the turbinates, the volume, the open volume in the nose decreases a lot, and the air kind of compresses. So you have a velocity increase in the airstream. So the speed of the airstream increases quite a lot when it passes the turbinates, and that velocity increase helps to activate those thermoreceptors. So when you remove the turbinates, there will be no such compression of the air, and the remaining receptors in the nose will be less activated. So that's one reason, and you can feel that yourself. If you have a healthy nose and you inhale, you can inhale slowly. You feel it's not that cold, but if you inhale strongly, you can feel you have a stronger sensation of coolness in your nose, and that's exactly what I'm talking about. When you have those turbulence there, the air passes, it compresses, the velocity increases, and those remaining receptors is activated way more. So yeah. So I have one example for you here. This is a CFD study, I think it's called. It's an airflow measurement study. And on the left side here, we have pre-surgery measurements. And on the right side, we have post-surgery measurements. And the color here shows the velocity of the airstream. This is somehow calculated by a computer. So blue color means low airspeed or zero airspeed, and then green becomes a little bit higher, yellow, orange, and red is the highest velocity. So you can see here before surgery, you can see it's quite narrow here. This means that you have a lot of higher air velocity here. And if you look on the right side after surgery, you can see here that this, for example, this area here is this area on that picture. It's blue. This means that there is no airspeed here, or at least very little airspeed. If you compare that before the surgery, here is green. So here you have kind of 2 meters per second or something. So this is the exact thing I'm talking about. When you decrease the size of the turbinates, even if you still have some receptors remaining in this turbinate, there might be damage from radiofrequency, but if there are still functional receptors here, those will be activated less because it's open now, and the velocity of the airstream is lower, and you can clearly see this on all of the image. You can pause here and look for yourself, but that's one reason. It's not the biggest reason. I think the biggest reason is still the damage to the thermoreceptors. But yeah, it's one reason. And here is another reason as well for ENS. And when you remove the turbinates, or if you do heavily performed radiofrequency, for example, so the turbinates shrink down extremely much, the airstream will change inside the nose. The body is designed for having you inhale, and once the air hits the front part of the turbinates, it's divided. So you get a little bit air between your lower turbinate and your nasal floor. You get a little bit air between the lower inferior turbinate and the middle one, and you get a little bit of air stream coming up in the nose like this. So if you remove the turbinates, this airstream will be affected, and this can also be a reason for lack of air feel inside the nose. This could also affect the ability to sense smell, to feel how things smell, because you get less of these particles far up in the nose. And also there should be, for have optimal sense of smell, you should have one nostril a little bit more open and one nostril a little bit more closed, for having a different kind of circulation of those particles in each nostril. So what you see on these pictures, here is a healthy person who haven't had any surgery to the turbinates or septum. And you can see here there's one airstream on the surface, on the nasal floor here. There's one airstream between the inferior turbinate and the middle turbinate, and there are airstream going up, far up in the nose. If we look at the B, the middle image here, we can see that the airstream is moving along the nasal floor, and not so much on this area. I think it's called the middle meatus or meatus. It's between the middle turbinate and the inferior turbinate, and a lot of air is coming up in the upper part of the nose. And this person here, he had surgery to his middle turbinate, so he has some volume loss up here. So you can clearly see that a lot of air comes up this way. So it works a little bit like water. Water always takes the easiest way. So if there's less air resistance here, the airstream will take this way. This means that there will be not so much airflow in this direction, and if there are any remaining functional receptors here, they will not be activated like they should. So if we go to C is a person who had surgery to his lower inferior turbinates down here. I think he, according to how the image looks, he probably have a bit of inferior turbinates remaining here in the back. But you can see that air comes inside the nose, and you get turbulence here when it hits the new head of the turbinate, which is probably the middle part in before surgery. So now the air moves mainly above the inferior turbinate in the middle meatus. So yeah, you get some kind of, it doesn't spread like it should. The upper part of the nose here gets way less of the airstream, so it can affect the sense of smell. It can affect how much this area is, these receptors, these thermoreceptors, how much they are activated. So it's those three reasons, from what I understand of empty nose syndrome. First, those receptors are removed by the surgeon when he removed the turbinates, or they are destroyed during radio frequency. Secondary, they are destroyed by dryness years after the operation, or they are destroyed by infection. That happened to me also. I got one infection 4 years after my surgery, and the few remaining receptors got damaged, and I got empty nose syndrome completely first 4 years after the surgery. I had problems before, dryness and sleep problems, but not really so much air hunger sensation. That came after the infection. So it's that reason, and it's the another reason I talked about before, where the air velocity decreases and those receptors are activated less. And it's the third reason here, where the airflow doesn't spread like it used to do in the nose. So it could be some areas inside the nose that's not activated by the airstream like they should do in a healthy nose without surgery. So I'm now going to switch and talk a little bit about the different methods for surgery of the turbinates. So the first method I'm going to talk about is radio frequency And that's a method where you insert a small instrument shaped like a stick into the turbinate and you heat it up. So you actually cook the turbinates from inside, and that destroys all the blood vessels within. So it makes the turbinate to shrink down, and that's why they do it, because they want to allow more air to pass the nostril. But the problem with this method is that you don't know how careful the surgeon is. Is he going to do one location and burn? Is he going to do 2, 3, 4, 5, 6 locations? So the more time he do it, the bigger damage you will get. And also some surgeons, they recommend the patients to come back like in a year and do it again. So eventually these people will get dramatically damage of the turbinate. So, and it's also another problem, even if the surgeon is careful and only do it at 1, 2, 3 locations, he can put it too close to the surface of the turbinate. And if he burns when it's too close to the surface, he will also destroy the outer part of the turbinate. And that's where you have all the function. You have the cilla, the small hair, and you have the goblet cell that produce all the mucus in the nose, and you have all those kind of nerve endings, the receptors that sense different stimuli in the nose. For example, the thermoreceptors that sense the airflow. It's those receptors where you can sense the cool sensation when you inhale. So if the surgeon burns too close to the surface of the turbinate, he will destroy the outer part of the turbinate, and then you become numb. You will become extremely dry and numb. And since he also destroys the blood vessels, the nose will not be able to regulate the airflow anymore, so it will always be open. And that's not good for the breathing, not good for the relaxing state, and it's not good for the mucosa, because the mucosa, the nose will always be open. So there will be, in the long term, secondary damage to the mucosa from dryness, maybe from infection. So the second method, it's called coblation or electrocautery. I'm not sure about the words in English, but it's a similar method to radio frequency. It's more or less the exact same, but you use higher heat with this one. So you have even further destruction of the nose. So I wouldn't recommend any of these methods, or I wouldn't recommend any surgery at all. But definitely not coblation. It's better to do radio frequency. Another method is when you use something which is called a micro debrider. It's more or less like a stick, and on the top of it, or inside it, you have some knives. And when you insert it into the turbinate, it actually tears and destroys the turbinate from within. So in one way, this method is better because there is no heat, so you can't really damage the outer part of the mucosa. But like you see on the image here, if there is one surgeon who are careful, he will just insert it straight like this. Only one time, straight into the turbinate and back out, and he's done. But if the surgeon do like this, he insert it and he start to move it around, he will destroy all of the tissue inside here, and the turbinate will not be able to swell up. It will just be you will just only have this skin part, mucosa part, and blood vessels and everything within the turbinate will be totally destroyed. So the nose is going to be extremely open. So another method is lateralization of the inferior turbinates, and this method can cause damage, of course, as well, but it's considered to be the safest one. So you actually insert like an instrument and you break the bone within the turbinate and you re-angle it. So you break the bone and you move it towards the lateral wall, towards your sinus wall. So you move it from this side to that side in the right nostril. And if you do it in the left nostril, you do it on the opposite. So from this side to that side. So it allows more air to pass between the turbinate here and the septum. And if it's not good, I think you can, it's not a good solution, but you can probably move it back. It will not be perfect like it was before, but it's, in most cases, is probably, it can be done probably in most cases. And the bad part with this solution is that when you move it inwards like this, all this area here will be will not receive any airflow. So this part is more or less like it become numb. So, but yeah, you still have some thermoreceptors and everything here, so I think it should be fine. But you have to understand that you will get less sensation, less perception of airflow in the nose. But I think this method is the, if you're going to do any surgery at all to your nose, this method is probably the best and the safest one. So the worst part, I guess, that can happen is if there is some nerves inside here that will tear when he re-angles it. I guess the turbinate can become numb, and I heard some people who had this. I don't know how common it is, but it's one thing to think about before having this kind of surgery. So the next method is partial removal of the turbinate, or you can remove the whole part with like a scalpel or with the scissor. So it depends on what the surgeon thinks it's best for you. So there's no right or wrong way to do it according to the surgeons. If he thinks it's best, he can remove the entire inferior turbinate, or he can remove the first like 2 centimeters or the first 4 centimeters. So yeah, this is the method I had. So like you see, these are my pictures before the surgery. Here the turbinates are all the way to the front here and all the way back. But after the surgery, you can see here that it's like the free hanging part of the turbinate in the front here is totally gone. So it's just the back part here, the posterior part. So I would say in my case it's not more than like maximum 2 centimeters left of the turbinate. So this is the absolute worst kind of surgery you can do. It will destroy you, and it will make you numb for air perception, air sensation. You won't feel any air coming into your nose, or at least it will heavily reduce that sensation. And there's also another problem with this method. I'm going to show you a little bit later here, but you know the part that is left here, it's not going to be untouched. It's going to be it's going to have a lot of scars from the surgery, because he removed this part and he tries to take the mucosa that's left over to like fold it and try to attach it to the flesh wound. So yeah, the remaining stump of the turbinate will not become functional. He will have a lot of scars, and on those scars there will be no functional mucosa. So there will be no functional cilia, the tiny hairs. There will be no functional goblet cells, no functional receptors. So it's just extremely stupid way of doing surgery to the nose. Don't do it. It will definitely, without any doubt, destroy you for the rest of your life. So this is how it looks after. So if you have a totally removal of your inferior turbinate, this is how it's going to look. So if you look on the bottom picture, here is an x-ray. So the turbinates, they should be all over this area coming down here, but they are now removed totally. So it's just a black open hole here. And this is how it looks inside the nose. So this is the upper part of the turbinate. This is the only part remaining now. All this part here below is removed. So the airstream here would be extremely destroyed. The air pressure would be destroyed. There is going to be less velocity of the air. It's going to activate the thermoreceptors less. The airstream will pass only here, not so much up to the upper part of the nose. It will also reduce the perception of airflow. So in the middle picture here you can see how it was before the surgery, and here it's how it looks after. Middle picture you can also see how open the nose is. Here you can also see a hole in the septum. So this person probably had a surgery to his septum as well. So let's talk a little bit about appearance change from septoplasty and from turbinate surgery. So this is my images. This is how my nose was before the surgery. Symmetrical, more or less perfectly symmetrical. And after the surgery, my nose become really thin, especially on the middle here, the middle part, and it become uneven, have some bumps and some kind of holes. And of course the doctors won't tell you this. So I think it's mainly 90% because the surgery to the septum, but it's a little bit, I think it's affected by the removal of the front part of the turbinates, because I have seen in other cases it can make this part of the nose a little bit less wide. But in my case, I would say 95% of the appearance change is related to the surgery of my septum. So I'm now going to talk about septoplasty and the risk and the complications that the doctor won't mention to you. Besides change of the appearance of the nose, there's also risk of perforation of the nasal septum. If the surgeon removes too much cartilage, there will be a hole between the two nostrils, and that hole cannot be easily fixed afterwards. Especially if it's a big one, you can't really do much about it. Some people, they try with septal plugs made of some kind of rubber or plastic, and yeah, it's not a good solution. Also, to be able to have surgery on the septum, you need to remove the mucosa from the cartilage structure. So when that happens, the mucosa will become damaged, blood vessels will rip and nerves will rip, and the mucosa will become numb. I'm going to show you a YouTube video after this slideshow here that explains how the mucosa will be damaged. And also there is a risk of destruction of the septal swell body. That's an area quite far back in the nose, just a little bit above the inferior turbinate and in front of the middle turbinate. It's also called the fourth turbinate, and it has a similar function to the other turbinates. It can secrete mucus. It has a lot of receptor cells like thermal receptors. It have a lot of goblet cells that produce mucus. So let's start to look at this YouTube video, and I'm going to explain what will happen to the mucosa during septal surgery. So what you see on this image is the septum to the right side, and the surgeon is now going to make a cut here to be able to insert the instrument and remove the mucosa from the wall. So I'm going to play the video and you will see how he does this. So now he makes the incision, and he changed tool for another, I think it's called an elevator, and he uses quite a lot of force to remove the mucosa from the wall here. And this is a problem. When this happens, if the surgeon is not careful, he will rupture the mucosa and cause a lot of tears in the mucosa. A common reason to why people have surgery to septum is if they have a septal spur. A septal spur is a ridge between these three plates. If you look at the image in the lower left corner, you can see there's three plates here, and if you get the septal spur, it's like a ridge between those three plates. So to be able to remove that ridge, the surgeon needs to remove the mucosa from the wall, and you can see on this image, this is where the septal swell body is located. So it's really close to the septal spur, and you cannot only remove the mucosa from the wall just here. You need to remove some extra parts of the wall to be able to see and operate. So on the upper left side here, you can see the septal swell body, the white area. It's an MRI image, and on the image to the right side here, and you can see my septal spur. This is before my surgery, so you can see how it's located really close to the septal swell body up here. And this image shows how thick my septum was before the surgery. I had a lot of functional blood vessels in it, and after the surgery you can see how thin it has become. This is another image showing how close the septal swell body is to the septal spur here. And on this image you can see that the structure of the nose has become damaged. It should be shaped like this here, but it's now concave here. And it's a trench. You can see it's a trench here, and the mucosa is super thin. You can even see some old parts of cartilage almost coming out from the wall here, or almost making a perforation because it's so thin. So the septal swell should be up here, and in this case you should not be able to see the middle turbinate because the septal body should be in the way for it. So these are some other images from my nose, and I'm now going to show you how a septoplasty will destroy the function of the septal mucosa. So on the left side here you can see two images from my left nostril, the nostril where I didn't have any surgery to the septum. I only had surgery to the turbinates here. And on the right side you can see my right nostril, where I had both surgery to my turbinates and to my septum. So if we look on the pair of images on the left side here, on the right of those images you can see how my nose looks inside when I had some decongestion spray. So you can see it's opened up, and on the left side here you can see septum, how it's shaped like that, and on the other side there's the remaining part of the inferior turbinate, and this is the middle turbinate. So on the other side I did one experiment here, and I was standing on my head to make the blood vessels to fill up and make the nose as congested as possible. So I stood at my head and I standed up, and immediately a few seconds later I took some images, and you can clearly see that there is a big difference between those two images. And I've been taking these shots like at the same location, so pretty much the same centimeters into the nose. So in the left here you can't really see much inside the nose, it's so congested. So that means the blood vessels and everything within the septal mucosa still works, and you can also see that the blood vessels on the lateral wall and in the remaining parts of the turbinates they still function. And here you can see it's open. So yeah, it's a big difference between those two images. But if we instead go to the right side here, where I had the septoplasty, you can see it's not really a big difference between those two images. And I also have to say that you can see some lines here. It's because I took some individual photos, and I'm trying to make one panoramic photo of them together. And it was hard to make it proper in this case. But yeah, on the left side here you can see when I used decongestion spray. So here it's as open as it can be, and you can see how extremely open the nostril is. And on the other side you can see it's after I've been standing on my head. So the middle turbinate could possibly swell up a little bit more. It's not totally at its biggest size, but it's pretty much filled with blood, and so you can see there's not really much difference between those two images. If you compare the left nostril here, you can see there's a big difference. It's narrow here, you can't really see into the nose, and in this one you can see a lot of space in the nose. So yeah, this tells you one thing, that all this area, the septum, doesn't work anymore. It's passive, it's super thin, it's like a millimeter, less than a millimeter, it's probably like a third of a millimeter. And yeah, it just can't swell anymore, and it can't regulate the air to the upper part of the nose. And when it becomes thin like this, it also becomes dry. And you can, like I said, you can get infections from it. And also another part is that and in my case, I lost the sensory function. I can't feel the airflow in this nostril at all. So I have some more proof here for you how a septoplasty can destroy the blood vessels within the septal mucosa, and how it can destroy the septal swell body. And there is a pair of images to the left hand side, and there is a pair of images to the right hand side. So on the right hand side there is my right nostril where I had the septoplasty performed, and on the left side there is my left nostril where I had only surgery to the turbinates, the inferior turbinates, performed. So the other images you saw on the previous page, they showed some panoramic views of my nostril. In this slideshow, I'm showing just a local picture in front of the septal swell body. So if you see on the left side here, the left image is when I had been using decongestion spray. So you can see it's open and you can see the shape of the septum here. This is the lateral wall, this is septum, and this is the location of the septal swell body. And this is the middle turbinate. So when I have been using decongestion spray, you can see how this area has been opened up. So after that I did another experiment, and I was standing on my head like the previous one, and then the blood vessels will become dilated and the nose will become as congested as it can be. So you can see, like now it's not possible really to see. You can't see the middle turbinate. The middle turbinate it's behind here, and you can clearly see how the septal swell body has been increasing in size here. So this tells you one thing for sure. It tells you that the septal swell body works. Yeah. And if you go to the other side, the side where I had the septoplasty. So on the left image here, you can see the septum on the right side here. This is the lateral wall, the wall where the inferior turbinate is, and the wall next to the sinuses, the maxillary sinus. And this is when I have been using decongestion spray. So now you can see it's open, the middle turbinate it's quite small. You see there are some area here it can fill up. And if we go to the right image, you can clearly see now the middle turbinate here is extremely big. It has like filled up the whole area here, so it can't become any bigger than this. It's just impossible. So this tells you that I have congestion in the nose as much as possible. But the thing is, you can still see the middle turbinate. You should not be able to see the middle turbinate here. That's the problem. So this tells you that the septal mucosa here, the blood vessels, the bigger blood vessels within the septal mucosa is damaged. And it also tells you that the septal swell body area up here is damaged, because it should swell up in a shape like this. So you should not be able to see the middle turbinate exactly like this. Here you can see it, here you cannot see it. So it should be exactly like that. And this shows how a septoplasty will destroy the function of the septal mucosa. That's a proof for sure. And the surgeons, they probably know about this, but they won't tell you. They won't tell you. And like I told you before, when the mucosa becomes thin like this, it will become dry. And when the surgeon tears the mucosa, he also tears the nerves and the blood vessels, and it will become numb. And like I said, it will become dry, and from the dryness you can get the infection, and that infection will damage the mucosa even more and damage the remaining functional thermoreceptors even more. So yeah, in my right nostril where I had the septoplasty performed, I had absolutely no air feel. I can't feel the airflow in that nostril at all. And when the good left nostril has closed off, I just can't feel the airflow at all in my bad right nostril. And that's when I have the air hunger, the suffocation sensation, the distress, the sleeping problems. This is when I wake up all the time at night, breathing through my bad right nostril where I can't feel the airflow at all. So now you know what can happen if you do surgery to your septum. So let's talk a little bit about how common complications is from surgery to your turbinates. So this is a study made by Stephen Hauser. He actually looks on several studies and compare those and compare what kind of surgery that was performed and what kind of complications the patients had within 2 to 7 years after the surgery. So like it is now worldwide, there is no specific method of turbinate surgery that is recommended. Surgeons can do whatever they want to do. So if you're unlucky and you get a surgeon who likes to remove the entire turbinates, you're going to get really bad outcome. You're going to get empty nose syndrome. And if you find another surgeon who just do radio frequency, you might not get empty nose syndrome. You might get other problems, but you never know. You can also get that from septoplasty, from radio frequency. So in this specific study here, I'm going to look at when people had their entire turbinates removed. So when people have their entire, I'm not sure if it's only inferior turbinates or if it's only inferior turbinates, so people who had their inferior turbinates totally removed, those people had within 2 to 7 years a lot of problems, and 89%, 9 out of 10 people had chronic dryness. 66%, 7 out of 10 people had atrophic rhinitis, some kind of degeneration of the mucosal membrane. 22% had osina, I'm not sure about spelling, but that's an infection where the nose produces green mucus that smells really bad. Also 11% had problems with dry eyes. So if we go to the next slide, we can see all the different studies Stephen has been looking at. So if you look at submucosal resection on the right side here, submucosal resection is a method where you don't destroy the outer part of the turbinates, the part where the cilia is, where the goblet cells is, where the thermoreceptors is. So you still leave that part of the turbinates intact, and you only remove the central part, the blood vessels within, and reduces the volume of the turbinate. So if this performed in a good way, at least in theory, it should not affect the function that much of the turbinate. So you can see that only 10% had crusting, only 2.8% had syncytia. It's a thing where, for example, left side of the nose can grow together with the right side, or inferior turbinates can grow together with the nasal floor. Only 2.8% had that, and only 2.8% had poor MCCT plus IgA. I'm not sure what that poor MCCT is, but I think it's lack of IgA, so it's a lack of antibacterial function in the nose. So only 2.8% had that, and there were no people who had atrophy, degeneration of the mucosal membrane. So based on this study, I can only say that the method is important. So if you're going to have surgery, choose your surgeon and your method really carefully. Now I'm just going to talk about other problems you can have from nose surgery. So this is the thing I was talking about before, nasal adhesion, or I don't know how this spells, Nasal synthetia. It's the thing where some parts of the nose can grow together. So in this case you could see that there are some connection between the tissue of the middle turbinate and the lateral wall, and between the middle turbinate and the septum. So this happens if the surgeon doesn't put protection properly inside the nose after the surgery. And on this side you can see adhesion between the remnants of the inferior turbinate and the septal wall. Also, another thing that will happen if you have your turbinates partly removed by scissor or by scalpel, you will have some scar tissue to the remaining stump of the turbinate. So in this images here you can see, it's actually my images in my nose. So you can see there are some white parts here. There are scar tissue here and here, and that scar tissue is non-functional tissue. It looks more or less like the skin under the foot. It's doesn't have any like functional thermoreceptors or goblet cells or cilia. So even if this stump is like left over, if the surgeon didn't remove this, this doesn't mean that this part of the turbinate will function. This will still become destroyed, and you will not be able to sense the airflow, or your airflow sensation will be heavily reduced. So this is what I was talking about before, septal perforation. This is something you can get from septoplasty. If the surgeon removes too much of the cartilage, you will get a big hole here. And if it's this big, it's nothing to do really. You can't fix this afterwards. So you will have a open hole between your two nostrils, between a left and a right nostril. Here are some other images that shows the hole between my left nostril and my left maxillary sinus. So you can even see them on the x-ray here and here and here. So in my case the hole is probably a centimeter, so I was lucky, but yeah, it could be the entire wall that collapses and becomes destroyed. So another thing you can get is degeneration of the mucosal membrane. These are my images, and these are my images 4 years after my surgery. I had some kind of bacterial infection, maybe by Staphylococcus or MRSA, I think it's called. So when the surgeon removes big parts of the turbinates or the whole parts of the turbinates, or when the septal mucosa is destroyed by septoplasty, the nose will become dry. It will lose the ability to defend itself from bacteria and virus. So yeah, you can see the images here. They are, some parts of the mucosa is white. Actually, most part of the mucosa is white, and it should be red like this here and here. So this means that there is some kind of infection or degeneration ongoing. So this is something you will get in time if you remove the turbinates or if you destroy the septal mucosa. This is the back part of the nose. It's also some scarring and some white tissue here. It's because there are cold air in a constant flow coming back, hitting the wall back there, and it dries it out and causes a lot of pain, and causes scar tissue to form. These are also some images showing degeneration or maybe inflammation of the mucosal membrane. This is in the upper part of my nostril, beside the upper part of the middle turbinate. You can see the white part here shows that there are some kind of degeneration ongoing or inflammation. So yeah, this is something you can count on if you do this kind of surgery, long term at least. This is another part, the upper part of my right nostril, where I have this degeneration and inflammation as well. And if I touch this area, I will have like a nerve pain inside my right eye as well. So I know many people have nerve pain shooting out in the eye or in the face, and it's not uncommon after this kind of surgeries. I showed you this image just before, but if you remove the turbinates, these parts you see within the green circle here, the airflow will not spread evenly throughout the nostril. You will have a jet stream of air flowing along your nasal floor, and it will hit the back part of your nose. It will dry it out, and it will cause inflammation. It will cause scar tissue. And this white part here you can see in my nose is scar tissue. So this is the bottom part of my inferior turbinate, and this is the nasal floor. And now air moves just along the nasal floor, and it hits the back part here, the nasopharynx, and it's painful. It causes dry throat, and it causes scar tissue on the back part here. So that was a little bit about complications that you can have if you choose to go forward with septoplasty or turbinate reduction. Of course, there are other things that can happen, but there are some of the consequences. So I was now supposed to talk a little bit about why these kind of surgeries is performed when we have a lot of scientific research and we have a lot of patient stories who claim they are worse after these kind of surgeries. But I've been talking quite a lot now, and this YouTube video is starting to be long, so I'm going to skip that. If you are a Swedish viewer, you can just read this page yourself here, but basically it's about money, and they don't care at all. It's an old system, and they don't want to evaluate again this. They started this kind of surgeries like 30, 40, 50 years ago, and they don't want to reevaluate, and they don't want to listen to the patients. So yeah, and the thing is, these kind of surgeries is going to still be performed. More people are going to be damaged. So yeah, the only I can do is try to inform you what the consequences will be. Yeah. So I'm now going to talk a little bit about why we have these symptoms of suffocation and air hunger, because most doctors, or maybe not most, but some doctors, they don't want to believe in empty nose syndrome and suffocation, the air hunger problem. I think this is because it's a threat against their jobs, against their companies. So they don't want to listen to the patients, and they say it's just up in our heads, we can't explain this, we don't know. But the truth is, I've been looking at quite a few scientific studies now, and there are explanations for the air hunger, and it's not complicated really. It's just that these surgeons, the system, they don't want to admit this. They don't want to search for an explanation, because that explanation would say don't do turbinate surgery. So if we start here first with a study, this is a study where they had two groups, one group with empty nose syndrome patients and one group with healthy, normal people. So they wanted to see if there could be a different brain activation in patients with empty nose syndrome. So they allowed these two control groups to smell menthol. This is a substance that activates the thermoreceptors inside the nose, similar to just cold air. So they made the two groups smell on that, and they made also those two groups to smell nothing. And when they did those two things, they looked at MRI, and they were looking at how brain signals were, how the brain was activated, and they could see different cerebral activation in the brain, and they could see that when people were, both groups were smelling nothing, they could see that the empty nose syndrome group, they had no activation, or they had a different kind of activation in this, a different kind of cerebral activation in the brain. So this is an image I found from the study. Unfortunately, I didn't want to pay for the whole study, so there is no explanations really, because I had to pay money for that. But this is what they were looking at, how the brain was activated. And they could see on empty nose syndrome people, when these were smelling nothing, there was a difference between the normal healthy group and the empty nose syndrome group. And when they allowed the empty nose syndrome group to smell on menthol, so these remaining thermoreceptors in the nose were activated, they could see a similar activation in the brain of the empty nose syndrome people like the other healthy group had. So this is important, and it shows really that is related with these thermoreceptors and other receptors. If you activate these receptors, you will get some activation in the head, and they also made a conclusion, if this signal is not sent to the brain, there will be an activation of the limbic system. And the limbic system is a system correlated with stress response, sleeping problems, and stuff like that. So from that study, we know that the limbic system in the brain is activated if these signals from the nose, the signals from the thermoreceptors, if that signal is not sent to the brain, we know from the study that the limbic system in the brain is activated. And you can read this yourself. I translated this into English. So if you look at the brain here, these are the different areas that are affected or that are correlated with the limbic system. And these are other areas you can see. This is kind of same areas, but in different separate images. So you can just take a look. It's a lot of things in the brain that is affected. So for example, I'm not going to read up all this because I don't know how to pronounce it in English really. But I'm just going to read up what will be affected when the limbic system is activated. So this part here, amygdala, is involved in fear and aggression. Hippocampus, it's related to how you navigate when you are like outside walking, so how you can remember where you are and where you should go, and to navigate. It's also related to the short-term memory. Hypothalamus, it manages the release of hormones, and it also regulates the heartbeats, and the orbifrontal cortex, it's involved in cognitive processes of decision making, and mammillary bodies is important for the episodic memory. I think that episodic memory is the short-term memory. And last one here, stria terminalis, plays an important role in controlling autonomic and this word I don't neuroendocrine and behavioral responses. So, like you see here, when the limbic system is activated, like it is when you have empty nose syndrome, when these signals is not sent to the brain, there will be a lot of consequences to your nervous system, to your brain, and it will affect your entire body. This is another image I found when I did research about the breathing and the nose. So from studies they can find that if they look at healthy individuals who had no surgery to the nose, they can see that the nasal breathing, it regulates the autonomic nervous system, the activation of that one, and the brain activity. And that happens through mechanical stimulation of the neurons in the nasal cavity. And that's exactly what I've been talking about the whole time now here. It's the nerve endings and the thermoreceptors and all other receptors that are affected. They can also see that nasal breathing increases alpha waves in the brain, and alpha waves are those brain waves you can see when you look at people who are relaxed. They can also see that the nose breathing stimulate the vagus nerve, I think it's called. It actually increases HRV throughout parasympathetic activity. So HRV, it's method where they measure time difference between each heartbeat, and when you are stressed, you have HRV that are low, and when you feel good, happy, calm, relaxed, you have one HRV that are high. So in my case, for example, I have a watch, just a simple watch like that registrates my sleep and my stress levels and everything, and I wake up like every 2-3 hours, and when I do that I have problems with my breathing. I have like I told you before, the suffocation, the air hunger, and I can't feel the airflow in my right nostril. So each time when this happens, I can see on my watch that my HRV is low, which means I'm in stress activation of my nervous system. This is another study I found when I did my research, and it's not about empty nose syndrome, but anyway we can make some really important conclusions. In this study they were looking at a group with sick people who had epilepsy, and they were comparing that group with just a normal healthy group. So one thing they were looking at was how the brain activity of those people with epilepsy was affected from how you were breathing, if you were breathing through your nose or if you were breathing through your mouth. So I'm not going to read all of it. It's translated already into English with Google Translate. So the conclusions they made is that breathing through your nose synchronizes electrical activity in the piriform cortex as well as in the limbic system related areas. And these are areas that affect the person's cognitive functions. So the functions, how the brain works, how quick it works, how quick you can take decisions, how good they are, how quick you can react to stimuli from outside, how quick your thoughts is, for example. So yeah, actually how your brain works. So one of the conclusions they made was that the cognitive function of the brain increased quite a bit when the breathing was performed through the nose. So for you who are thinking about having septoplasty or turbinate reduction, you must understand this. It's extremely important. A surgery to your nose is not only a surgery locally in your nose, it's a surgery to your nervous system and to your brain. And that surgery, if too much tissue damage is caused, there will be consequences, irreversible consequences to your health, to your sleep, to your stress levels, to your relaxation. And of course, this is related through the stimuli of the thermoreceptors, because breathing through the mouth should be better actually, because you can get more air if you breathe through your mouth. So it's related to these receptors, and if you don't stimulate these receptors, it will affect your mind and your nervous system and your brain. This is another scientific article I found about empty nose syndrome and the connection to the limbic system. So again, it just says that if your turbinates and your nose is damaged, so that the sensory function is damaged, there will be no signal sent to the brain via the fifth cranial nerve, and that causes a distress among the patients. If we go down one step to the scientific study 1 here, they could see after nose surgery that there were some changes to the aerodynamics inside the nose, and they made the conclusion that this is part of the reasons for empty nose syndrome, but one part was also the sensory reason where those receptors get damaged. And unfortunately, they say, like most doctors say, it could be predisposing conditions behind this condition, and that's just fucking bullshit. I hate to hear that, and it's not true. Anyone can get this condition. It just depends on how much damage you will get on your nasal turbinates and on the septum. It's just one way for the doctors, for the healthcare industry and healthcare system to transfer the responsibility for these conditions to the patients, to transfer it for the patients and be out of responsibility themselves. And one more below here, scientific study 2, empty nose syndrome. And so yeah, they also say that alterations in the local environment in the nose, disruption of mucosal cooling, that's the thermoreceptors they are talking about, and disruption of the sensory functions in the nose. So there are quite a lot of studies, and I haven't been looking at all the studies, but there are a lot of proof, and we don't need more proof. These kind of surgeries, they affect your whole organism, your whole nervous system, your brain, and it's not just surgery locally in your nose. And that's something doctors won't mention to you. Okay, new side of the slideshow here. It's also a new day for me recording. I haven't been doing any recording on this now for like 1.5 weeks. I have slept so extremely bad. I had a lot of problems with air hunger. Been waking up like after 2-3 hours. So I'm totally exhausted. So I'm just going to show you this. This is how my sleep was a couple of days before today, and I fell asleep around 1 o'clock. You can see where the purple area is here, and I woke up around 3 o'clock, and then I was awake the whole night here. Of course, I know I've been listening to a few podcasts, so I slept 2 hours, and this is normally how it works. I use decongestion spray in my good left nostril to force that side to stay open, and I take sleeping pill, and then I fell asleep, normally quite quick, but I wake up like in 2 or 3 hours. Then I have the shift from my good left nostril to my bad right nostril. So my good left nostril is now completely blocked. I only have the airflow through my right nostril. And this is the airflow, this is the side where I don't have any air feel. So when I wake up, I have high pulse, I have high stress levels, I don't feel relaxed at all, and I have air hunger, suffocation, breathing problems, how you say it. So this image on the right side, it's from my watch here. It measures HRV, so it measures your stress level. And you can see here that my stress levels the whole day is pretty high, up to 85, and most of the time it's above 35, around 40. So if we look like a normal day, or a normal day, it's not a normal day, but a day when I can force my left nostril to keep open, this is how my stress levels looks like. It's below 40 most of the time, and it's pretty often below 20. And you can see this is another day, below 40, most of the time around 20. So here you can see clearly how it affects my breathing. If I can force my good left nostril to keep open, I feel so much better. The problem now is I have been using so much decongestion spray, so it doesn't work anymore. I spray like 30-40 times and it doesn't open up anymore. So this means I have to breathe through my bad right nostril, and that's why I just can't sleep anymore. So I'm going to continue now with this page here to explain for you a little bit more about how a surgery to the nose is also a surgery to your brain. The study I have been looking on is this one, alteration in the nasal cycle rhythm as an index of the diseased condition, and the link is here. I'm too tired to read up everything, and I've been talking about the nasal cycle before, so you can just pause it and read it yourself. I'm just going to highlight here and talk about a few really interesting conclusions from this study. I think it's important that you know about before deciding to have surgery to your nose or not. And for example, they found out that when you breathe through your right nostril, you will have one increased glucose level in your body, which means that you will also have more energy. More insulin will be pumped into the cells in the body, and you will have one increased energy level. So the opposite matters when you breathe through your left nostril. You will have a decreased glucose level in the blood and also a decreased energy level in your body. So this should be like a natural shift. The body should be like speeding up a little bit more, being more active, and then it should shift, and that is regulated by the hypothalamus. So this shift when you have one side or both sides of the nasal mucosa destroyed, this shift won't function. If you have damaged those thermoreceptors, the brain will not get this signal, and it can affect your blood glucose levels. Another thing is that breathing through your right nostril activates the left part of your brain, the left hemisphere of the brain. And this part of the brain is more involved in processing, when being active, when it's responsible for logical thinking. And when you breathe through your other nostril, when you breathe through your left nostril, this activates the right hemisphere of the brain, and this side is more responsible for creative thinking. And you can read more about the right and the left hemisphere of the brain yourself, and you can find out that it's a big difference what each part do or not do. And another thing they found out is when the turbinates congest, they secrete more mucus. So when you have more mucus produced, you also have better protection against dryness. You have some substances in the mucus like lactoferrin and IgA antibodies that are antibacterial and antiviral, so you get a protection from virus and bacteria. So if you destroy or remove your turbinates, you will have a immune system in the nose that is heavily reduced. So that's another thing. They also realized that the nasal cycle is related to catecholamines, the level of catecholamines in the body, and those are like the stress hormones in your body. So I'm not going to say much more about this study. Just that you have to realize, I've been saying this so many times before, I'm going to say it one time again, a surgery to your nose is not a surgery locally in your nose only. It's a surgery to your nervous system and to your brain. So let's continue with the last scientific study here. The study I have been looking on is this one. And the aim of the study was to evaluate if slow breathing could affect cognition and relaxation. So before I start to talk about the conclusions from the study, I want to mention something that is well known among us patients who have empty nose syndrome. So if you remove too much of your turbinates, or if you remove them totally, or if you remove cartilage from your septum, or destroy the vasodilation function of the septal mucosa so that mucosa can't swell up anymore, the nose will become a lot more open. So your natural air resistance will not be there anymore. This means that you will have a more shallow breathing and a more rapid breathing. So more breath per minute and less deep breath. So this is partly a reason for breathing problems among patients who have empty nose syndrome. Some people have mostly thermoreceptor related problems where those thermoreceptors are gone. Some people have more problems related to just lack of air resistance. And if you have problems, lack of air resistance, you're in a better position, because then you could probably add some cartilage implants in your nose and fix the problem at least a bit. But if you have the damage to your thermoreceptors like I have, it's not really much you can do about it. So let's continue to look on the conclusions from the study. So the first one here, if one breathes slowly, at a frequency near 0.1 hertz, so 6 breaths per minute. That promotes relaxation, and it also maximizes the heart rate variability. So it maximizes the HRV, and if you have a higher HRV, you are more tolerant to stress. So if we go back and look in my case, I have a low HRV, which means I get a high score on the stress levels here. So they also write here that reduced HRV is related to stress-related disorders, including anxiety, depression, and epilepsy. Next point, they found out that relaxation techniques that involves slow, deep breathing have shown to help conditions of cardiorespiratory and stress-related disorders, including chronic heart failure, hypertension, so high blood pressure, anxiety, and depression. Something more they discovered is that the tidal volume and the respiratory rate are known to have relations to behavioral and emotional state. So for example, if you breathe with high volume of inhaled air, so a high tidal volume, and at the same time have a low respiratory rate, this improves how you can handle stress. So you will become more relaxed if you breathe slowly and less often. And the opposite matters if you breathe fast and shallow. This will trigger anxiety. So yeah. And lastly, they found out that slow nasal respiration can enhance memory function when tried among humans. So that's everything I want to say about this study. You can read more yourself if you want to. So I'm pretty much done with my presentation here. So I just want to say to you, stay happy, stay healthy, and stay away from the turbinator. And the turbinates are the breathing organs of your body. They affect the nervous system, they affect your brain. If you destroy them, it will affect your personality, it will affect your sleep, it will affect your stress levels, it will affect how your brain works, how good you can act to outer stimuli, how quick you can take decisions. It will affect your whole life. So with this, I just want to say that think over this over and over and over again. Try to find other people who did this surgery, talk to them, because if you talk to the surgeons, they will not tell you what can happen, and they don't know and they don't care. So my life was destroyed from this surgery. It's basically over. I'm going to suffer for the rest of my life. My sleep is going to be like 3-4 hours each night. So the only thing I want to have out from this, I don't earn any money at all. I have nothing to gain from this, rather than I want you to rethink if you really need nasal surgery, and think what happened to me and think what happened to other people, and decide whether you want to have this surgery or not. So lastly, if you like this video and if you want to share it to other people, if you want it to be spread, please like or subscribe the video. It helps YouTube a lot to spread the video to other viewers. So yeah, that's everything from me. I wish you a good and happy life.